and thank you for joining the Superior Health Quality Alliance Roundtable conversation. My name is Elena Baer, and I'm joined by my colleagues Kim Heft and Jerry Hineker, as well as other Superior Health colleagues that will assist in answering questions for today's event. For those of you who have been joining these meetings, welcome back. For those of you who are new to the call, we're glad you're here. We host this session each week, and it's a 30-minute education session where we highlight important topics related to COVID-19 vaccinations and boosters and other nursing home topics, and then a 30-minute session for question and answer at the end. Also at the end, we'll provide a survey that we ask you to take a few minutes to complete so that we know what types of things you want to hear from us in the future. Jerry will place the link for the PowerPoint presentation slides in the chat in just a moment. And please use the chat box to share any comments, questions, or anything else that pops into your mind, or just unmute yourself to ask a question throughout the presentation. We don't have a lengthy presentation this afternoon, and we would love to hear from all of you. With that, I also want to give a quick scheduling update. Last meeting, we all talked about what type of frequency would be helpful for you with these calls. They were every week, and now we want to try to switch those up to be mindful of all of your time. And what we decided last week, that the second and fourth Wednesday of the month would be the best schedule for all of you. So we also have some holidays coming up, and we want to make sure that we're not hosting these calls while you're very, very busy doing all of the holiday things. So next week on the 23rd, we canceled that session, but then the sessions on November 30th and December 7th will be held as usual. And then after that December 7th call, we'll start that second and fourth Wednesday schedule. So that's why that 14th is canceled, but we'll host a call on the 21st. And then we're canceling the December 28th and January 4th sessions for those holidays as well. Then the sessions will resume on a normal cadence beginning January 11th. So you can expect those on the second and fourth Wednesday of the month. You will be receiving an email to re-register for these calls at that time. So actually, I think that's going to go out this week. You'll get that new registration email. So you can re-register for our calls, and we're going to start this new cadence up really officially in January, but it kind of looks like that in December as well because of the holidays. So keep that in mind. We'll be here not next week, but the following week to have another one of these sessions. Our objectives for today are to answer questions about reporting into the National Healthcare Safety Network, or NHSN. We'll describe some tips and tricks for NHSN, and we'll provide resources for NHSN education. At the end, we'll allow you, like I said, if some of your questions aren't included in these slides, and again, it is a brief presentation, please feel free to ask any questions that you have. If it's something that can't be answered during this call, we have a team of my colleagues who are willing to get on a call and have a one-on-one conversation with you. The first topic we want to cover are what are event level vaccination forms. So back in, I believe, May of this year, CMS announced that they were no longer going to be updating those tracking forms, the Excel forms, and that they were shifting more to being able to track everything in NHSN. So the event level tracking forms were what came from that. So these are a way of tracking and submitting resident and healthcare professional vaccination information directly within NHSN. So those of you who were using the Excel forms that were out there that you could then tally things up and count things there, those stopped being updated. So you probably don't get new versions of those that include new columns for boosters and things like that, because everything now is trying to be moved over to these event level vaccination forms where they do add those new boosters or the up-to-date status, et cetera, all within NHSN. Now, these allow you to track and submit information at the person level. So what you would do is you could add each of your residents, for example, into this system, and then you would be able to keep track of them as individuals right in NHSN. And then NHSN automatically calculates and displays weekly totals. So no more manual calculation and counting things up and putting them in that area of NHSN. You would go to this event level vaccination form, and you're able to save and submit and it does all the counting for you based on what you're doing for each individual person in NHSN. So my question for everyone out there, who is already using these event level tracking forms in NHSN? You can pop that in the chat, or if anyone wants to talk about them or has any questions about them, you can feel free to unmute yourself.
This is Chris from Catholic Elder Care. I have a lot of questions about them, so I'm super excited to talk about it today.
Yeah.
We've been using the templates and just kind of adding in at the very end what boosters we've been given and sorting and resorting them. So I'm looking forward to getting some more information from you. What I'm hearing is that with the event forms in NHSN, we'll still have to go in each week to make sure that we submit the data, but that it's automatically tallied. So I just want to, we've been so diligent here making sure that we get our weekly submission, and I want to make sure that I understand that while that hasn't changed, this will be a way or could potentially be a way to benefit us, because once we get the information in the event in NHSN, that there'll be no longer manual calculations, adding,
Yes,
subtracting. So
exactly.
right.
Exactly. So on a weekly basis, what you'd probably want to do, because you're getting new admissions and things like that, you'd want to go in and make sure that this event level tracking area within NHSN is up to date. But then there's just a button at the bottom, or I think it's actually at the top, that says like save and submit. And when you click that, it runs through and makes sure that there's no errors, because sometimes date of births don't end up in there, or there's other weird little things that could happen. And if that's something that is happening to you, you can reach out to our team and we can look at it with you and kind of go over it. But once you click that save and submit, it automatically saves and submits and basically submits your data for you. So every time that you go in there and update, let's say one resident, even if you click that save and submit, that's how you're saving your information. It's being sent over to CMS and then into NHSN, and they're able to have all that data right then. You don't have to count and put those aggregate totals anywhere because it's automatically doing it. The one thing I will say, a little confusing thing that happened with this, in my own opinion, is that they made it so that this was optional in the beginning. And so they kind of encouraged people to start using it back earlier this year, because then you could take your Excel form and you could upload it into NHSN, and it would put all that information in there. The tricky part now is that because they weren't updating those Excel forms anymore, and you've kind of created your own way to keep track of things, it probably won't translate over perfectly. So it would definitely take a pretty decent overtaking to make sure everything gets in there correctly, before you'd want to really do the save and submit and have that be what's counting everything up, because you want to make sure everything is correct within that event level tracking form, so that what's being sent over is what's actually happening. So I will say that that's probably going to be, if you want to switch over to these event level vaccination forms now, that would probably be the trickiest part, is that's going to take a decent overhaul in the beginning to make sure everything's in there. But once you have it in there, it is, I believe, pretty simple. And I'd love to hear from some of the people that are saying that they use it. Do you like it better than when you used to have to manually count things up? While people are, if you have more questions, Chris, while people are typing that in or feeling.
Oh yeah.
Yeah.
I was just wondering too, do you need the level 3 access to be able to edit the event forms?
And that's,
or
I think anyone can do it now.
Okay.
So I work with several people that I haven't had anyone that hasn't been able to access it. I guess I don't know if all of them are level 3, but I believe anyone can go in and edit that themselves. I don't know if anyone else on the call,
Yeah.
you know, that I'm incorrect on that. Like I said, I don't always ask people if they're the level 3 person, but I've helped plenty of people, and I'm pretty sure you don't have to have that access. I see some comments in the chat. So I'm using the forms for residents, but not for healthcare personnel, because it's hard for me to tell what the person previous to me did. That is a really, really tough piece of this. And I think it goes back to what we were talking about too, that things have changed so many times with how you're tracking all of these, and things could get lost and things like that. But Carrie, I guess I would wonder, like, do you like the ease of use when it comes to what you're doing for the residents? And Jennifer, I see you use it. Angie says, we are working on moving to the event level forms for healthcare workers, but are finding it very time consuming as we are not collecting some of the other data before. It has been very time consuming and we are now wondering if it is worth it. It is exactly what you're saying right now. I'm interested in hearing what others are feeling that have been using them. And I think that's a really good point. I think too, if you have a smaller facility, it might be easier than a really, really large facility to make this changeover because of those Excel forms not being updated anymore. Vicki says we started using it as soon as it was offered, and it has dramatically reduced the time needed for reporting. Carrie says, I'm lucky that my building is small, so I was able to get all the resident data entered. And once that was complete, yes, I like using it better than the Excel form. So that kind of gives you an idea. And I think it's probably worth a conversation if it's something that you're like, oh, like Angie mentioned, it can be really tough to get it all up to date because everything doesn't transition over perfectly anymore because of up to date and new boosters and things like that. But if it's something that you wanted to talk through with someone else that has worked with people that have done that, please feel free to reach out to someone on our team. I think we'll probably have some contact information at the end, and we can work with you and kind of give you some guidance on whether or not it's something that would take a ton of time and energy to switch things over, and maybe it's not worth it, but we can walk it through it with you. And yep, Carrie says, the way I make it less cumbersome is by doing daily data entry with admissions and discharges. And I totally agree with that because you can just still save and submit. So you know that something is getting saved there, and it probably leads to less stress on you too. I know people get really stressed out about meeting the deadline and things like that. And that also adds an extra layer of protection there if you're able to just save and submit pretty frequently. I enter everything manually each week because I dislike technology. I feel you, Nicola. That is a tough part of this. And I think too, if that is working for you and it's less stressful than to try to use a new piece of technology, definitely stay with that. There's, like I said, it's not required to use these event level vaccination forms. It is just optional. Samantha says, I still enter everything manually and have paper copy for healthcare worker and RSDTS.
Hi,
Residents?
it's Jennifer. It saves so much time from how I used to do it. Cuts down 2 hours of having to add everything up. So I do it twice a week, Mondays and Thursdays. I go in and make sure adding new residents as soon as they're here and discharging as soon as they leave. It runs so much smoother, and I'm at a smaller facility, so I am so glad we went this way than the way the previous one had done it, because I was getting frustrated to the point where I didn't want to do it anymore.
Yeah, I completely understand that. And like I said, again, I think too, right now it'd be probably pretty simple for a smaller facility to still switch over to this. If you're a very, very large facility with over 100 beds and things like that, let's have a conversation. We can look and see and try things out together and stuff like that. But I've heard by and large that it definitely reduces the amount of time and energy that is spent on making sure that we're reporting the correct things and things like that. So thank you all for this conversation. Are there any other questions on these event level vaccination forms? Angie says, does anyone know how long this process is going to be required for healthcare workers? So much of the guidance no longer takes vaccination status into account. I know we haven't heard anything about that. I don't know if anyone on the call has heard anything that hints towards that.
No, unfortunately, I have not heard anything. I wish I could say that I have, but I do not.
Elena, this is Holly at Catholic Elder Care, and if we do decide to make the transition over to the event level vaccinations, do we have to like get it all in there in one day? Or can we kind of like slowly work on it and then,
Yeah, so you can definitely slowly work on it because when you put the information in there, it will save, but it won't automatically submit. So what you would do in that case, and like I said, I think it probably warrants an offline conversation where we can talk through with your team and really help you with this. But it doesn't automatically have to submit the data into like that same, basically what it does is when you press the submit button in event level vaccination forms, it counts everything up and it puts that same information that you're already putting in that other area where you're answering the questions and the aggregate form. So as long as you don't press submit, it won't automatically do that piece. So you would just still report as you are right now while you're building this other area up and making sure that it's ready to go. The tricky part comes where things are changing with the people that are already loaded in the event level vaccination form. You want to make sure that their stuff is continuously being updated as well. Like if they're getting up to date right now and you're like, it's easy to overlook some of those things sometimes if you're trying to build that up. But again, I think it's doable. Like I said, though, definitely reach out to our team and we can talk about this in more depth and get a better idea of what your how many patients or how many residents you have and things like that and walk you through it.
okay. And then Chris, I'm sure you have an email to get a hold of. Thank you.
Yes, and we'll make sure that we put some in the chat too if they're not in the presentation. Usually they're at the end though. Okay, Marissa, I see that you don't see event level vaccine forms as an option for you. Definitely reach out to us and we can kind of take a look at that because they should be available to you, but let's definitely peek at that. Again, we'll put some email addresses in the chat so you have access to those because I don't have a screenshot on me right now to show you exactly where they are. But it should, I believe, be in the same area as where you go to report. It's just like a little bit further down on the list of options from where you usually click. And Angie asks, has anyone else had this thought about the requirements for healthcare workers and tracking all of that? Are we all a little frustrated with having to track all of that information? I think that's kind of the idea there. I'm seeing head nods. I'm sure that's probably the case overall. And of course,
with any intervention, it's just like, what are we doing or what is the end game? And even being fully vaccinated doesn't mean anything like it used to.
Yeah, and I think if we get more information, if we ever hear things, we will definitely share that information with all of you during these calls. So I promise if we ever get a nod or we are on a call where we hear that information, we will definitely share that with you. Oftentimes the same calls that you see come through your inbox are the same ones that we're attending. So we try to take that information from some of those calls and make it easier to digest in these calls. So for those of you who haven't attended before, that's kind of one of our goals through this call. But I appreciate those comments, and please, 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 if you didn't get to ask your questions about event level vaccination forms, you can reach out to our team offline. I know my email address was already included in the registration form, so you can definitely find it there. But we have plenty of team members that can help with this. So the next question, do I have to report vaccination information on Sundays? So this was always a big, huge question that we get. Because I know a lot of you who probably wouldn't typically work on a Sunday are coming in and reporting on Sundays, and you do not have to report your weekly numbers on Sundays. So you could come in on a different day of the week. You have to obviously plan it correctly so that, like, if you chose to do it, if you wanted to start this new schedule this week, you obviously have to plan it correctly so that you don't skip a week, that you're not missing data there, but you don't have to put that information only on Sundays. I've heard from so many people that have been changing their work schedule and coming in on Sundays, which make it difficult when you're a holiday weekend or you're trying to take a vacation or whatever else. You do not have to I think there was some confusing wording out there for a long time that made people think that it was Sundays was the day, but you could switch it up and you could report every Wednesday instead. You just have to make sure you're not missing any data for a week. It doesn't matter necessarily what day it's happening. So keep that in mind. Are there questions about that? So Samantha, you said the previous infection preventionist used to report on Thursday, so I keep my reporting week Thursday through Wednesday and always report consistently. Yes, I think the biggest piece of this is that you want to try to report consistently so that you don't accidentally miss a week somehow. So I think it's probably a good idea to pick one specific day of the week and keep that piece very consistent. But it doesn't matter what day of the week that is. And I think this is something I wish we could just shout from the rooftops, because I know how many people are coming in on a Sunday or taking time away from what would typically be some of their off time to report these things. But you can pick a different day. Just make sure that you don't miss any data for one specific week. Okay, does that piece make sense to people? Are there any questions on that? And I appreciate you, Samantha, for putting that information in there. If that was not okay, it sounds like you've been doing that for a while. If that was not okay, you would have found out by now, I promise. They would have sent something to you and told you that it wasn't okay. So I appreciate you putting that anecdotal information in there that you're already doing this. I'm sure there are probably others that are already doing this, but I talk to a lot of people who don't necessarily know this piece of it. All right, not hearing many other questions. So again, any of these questions or anything outside of this, feel free to ask. We'll try to get through the next couple of questions so we have some open time at the end. But the next one is, how do you enroll someone in NHSN? So we did include a link here that gives you the instructions, but you do need that person that's the NHSN administrator to get this started. That link will show you kind of the steps for that piece of it. Since I'm not able to like screen share and show you exactly what to click on in NHSN, definitely check out that link for that piece. But if you're the new user, you will receive an email that says, welcome to NHSN. What you'll have to do is accept the NHSN rules of behavior and complete a few more registration questions. And those will all be clickable from that welcome to NHSN email. Within 3 days, you should receive an invitation to register with SAMS. And SAMS is where you'll go through to log in to get to NHSN. You'll then have to go through an identity proofing process. And one of these two pieces is pretty new. And I actually myself went through it. Instead of having to go get documents notarized in person, you now have the option to go through this Experian process. So this is a separate interface. You'll provide similar information, your social security number and things like that, date of birth, but then you're going to send that over to this Experian, and it's not stored or saved any of that information, but Experian will do its best to validate your information. So they might ask you questions like, did you buy or what year did you take out a mortgage or something like that? Some of those specific questions to you, pretty simple overall. And then once you're done with that, it's a quick process. It doesn't have any impact on your credit score, but it is looking up some of those credit history like questions. And that is going to be the fastest and most secure method to completing this process. From what I understand, it might not work for everybody. So you might go through that and maybe you don't know some of those answers to those questions. And so it can't check your background. And then you might have to go through the document review. But if you go through that document review process, there's a form at the end of that invitation to register with SAMS. You need to fill that out and then bring some appropriate identification. It spells it out in that email. And you have to go get it notarized, and then you can send it to SAMS via secure upload or by mail. So that takes a little more time, obviously. It means that somebody has to leave your building to go get something notarized and then submit it, and then it has to be reviewed, and it could take a couple of weeks. That Experian process, when I went through it earlier this year, it was like that. And now what I do is I believe, let me see what it's called. It's on my phone. It is called Entrust Identity. And so when I go to log in to SAMS, an NHSN, I enter in the same information that someone who might have gone through the other process does, but I just open up that app and it gives me a code. I enter the code in and I'm able to enter into SAMS and then NHSN. I believe, Kim, you probably went through the other process. Do you want to describe what that looks like a little bit? You've got your grid card. Hard to see, but she's got her physical grid card.
It isn't working right now. Yeah. And I think maybe a lot of you actually did go through the grid card process because the Experian wasn't available for me when I started this. One thing I have to really drive home is that make sure that when you submit your enrollment registration, that you are using your legal name, all of the information that you are going to be presenting to your notary. That's where I went to, validate that I am who I am, has legal name, address, everything that you're using is the same. I had to go, not me personally, but I had to help a couple other people because they were using shortened versions of their name, not the right address, so on and so forth. So that really delayed the process. So if you're helping people and you need new users, make sure that you hit home on that in that area. And then when you do submit all of the information, you should probably get an answer maybe in a couple of weeks. I think that's how long it took for me for that answer, but it depends on how bogged down CMS is with this, or yeah, exactly.
And Samantha asked a great question in the chat.
Yeah.
I have a grid card. Is there a way to switch to the Entrust app? I'm not sure on that. We can do a couple of things. We'll test it internally. I'll work with Kim on seeing if she's able to just download it and have that work. I'm not positive. And we'll try to look for a resource that says it, and we'll try to make sure we present that at our next call. We'll test some things out over the next week or 2 weeks. We won't meet next week.
Let me ask real quick here. I gotta call my Keisha out. She's one of our colleagues at Superior Health, and she just is going through this process. My Keisha, did they give you any option, even though you had to go the old way? Any news about using Entrust?
No, I have not heard anything else besides what I submitted to them. So no, I couldn't use that system because it didn't give me like any reason. It just said, hey, you have to just, turn your packet in. So I did so.
All right. Well, thank you for the update. Just wondering.
And that could happen
No
too.
update.
Like, this is a great option, but for whatever reason, and they spell that out too, I believe in the email, that it might not work for everybody for whatever reason. So keep that in mind. I will say though, if someone has the opportunity to go through the Experian process, it is pretty darn simple, and it gives them access pretty quick. So it's a nice route to go down if that option is available to them. And we will definitely look into seeing if there is a workaround to use that Experian app, because we always have our phones on us, but that grid card might not always be in our back pocket. So definitely something we can look into.
I'll just say I took a picture of my grid card because I will always have my phone on me.
Great tip. I love that. Thank you. That's awesome. Very good idea. All right. I am going to hand it over to Kim now to take over the next couple of questions. You're on mute, Kim.
Yes, I see I am muted, but I guess I was just saying this does appropriately lead into the next question in regards to what do you do if your NHSN facility administrator no longer works there and you need to change this in NHSN. What I'm going to hit home on this is definitely being reactive as much as you can than proactive. So if you know that your facility admin is leaving for another job, kind of have that on your checklist that before they leave that they change that in NHSN to someone else. So actually that someone else too is, I guess, goes back to enrollment. So I would really suggest that you have at least 2 people that are able to access NHSN. One that has your facility administrator rights, and then your other person that whatever you want them to do. But let's just say that person leaves, well, is going to leave, so that you can go in and temporarily maybe give the other person admin rights so that you can continue to still submit your all your data timely. We've run into so many people, I feel so sorry for them, that they lose their person and they need to submit, but then there's nobody there and they get a new person, and then that person's not even in NHSN, and then before you know it, you have a snowball effect going on in regards to, CMS knocking on your door, giving you, pieces of paper saying, hey, you haven't submitted this week. Maybe a few of you gone through that. So definitely being proactive is what you need to do here. What else do I want to say about this? Oh, of course, if you cannot be proactive and you need to be reactive, we have information here where you can literally click on a link where you then fill out a form and submit it to CMS with the information for the new NHSN facility administrator. The one thing though, the person that's signing the form cannot be the person that is applying to be NHSN facility administrator. It needs to be someone else. And once you do that though, I believe you should have, it says takes up to about 5 days to complete the request to change over that facility administrator. The other thing I wanted to just mention too, of course, because there could be a lot of leadership changes. So that means there's a lot of email changes. So if you're going to have to change your email address in the NHSN system, change it in SAMS first, because it has to be changed in 2 different places. Change it in SAMS and then change it in NHSN. Because if you reverse this process, you are going to have no access to NHSN, and then you're going to have to reach out to the SAMS help desk to get it resolved. So just want to give you a little tip there too. And I also believe just make sure you're not using any generic emails. That's not going to hit home either, meaning ADON@sunnydalenursing.com, right? Or DON or what have you. It has to be a specific email. And I also believe if you haven't if you haven't logged in to NHSN in over a year, you have to start the process over again. I'm going to call out one more time. She's probably thinking I'm picking on my colleague here, Keisha, but was that it, Keisha? Was it over a year and you had to start over again?
That is correct. It had expired in March.
Okay, just wanted to double check. I didn't want to mislead anyone. So that's what I have for that section. Anybody have any questions? Okay. Cool. All right. So real quick here, also get this question quite a bit in regards to, if we do not have any weekly changes in NHSN, what do we do? Well, of course, you're going to report the same numbers as last week. This is where I just want to caution you. I have looked over data before for certain nursing homes, and I look at it because I'm like, wow, like it's the same for, a lot of weeks. And that, oh, don't get me wrong. That could be true, but it just makes me wonder. And I've had reached out where they were forgetting that you always have new staff and new residents that may leave and join the facility. And even though no new vaccines were given, you always have to take a look at who's coming in and out of your door with vaccination status. Okay, and next slide. Okay. Oops, I was already off one. Give me one more, Elena. Thank you. So I just want to talk just a minute about correcting incorrect data in NHSN. We know data accuracy refers to error-free records that can be used as a reliable source of information. When you, as a facility, signed up to NHSN, you clicked a little button that said that you agree to participate and consent submitted. Agreement to participate and consent submitted by each facility during the enrollment. Yes, that you are willing to follow the selected component protocols exactly and report complete and accurate data, So I just want to make sure that you know what you're signing up for, right? Also, correct data indicates that your external organizations that you're putting in, they also utilize NHSN data that may be for payment or regulatory implications. So it's so important to have the correct data, because you're having your state surveyors, your state personnel are coming in, and before they even come in the building, what do? They go look at your data.cms.gov, your COVID numbers, and they are using that as part of your initial entry to the building when they're looking at your vaccination data. Then you also, of course, have your SNF QRP that needs to be accurate, because for your COVID-19 measure and your measure for your healthcare personnel vaccination for influenza, that's all tied into your APU, right? Your payment, your yearly payment, so that what you're submitting is accurate, that you're on time, so that you don't have a 2% reduction for your annual Medicare dollars. And of course, the most important reason for your correct data is that you want to monitor your facility performance, and it's for driving your prevention activities, which of course leads to quality care. So I'm not preaching to the choir on that one, right? But it is just really important to make sure you got the correct data.
One thing I'll kind of add to that really quickly is that sometimes our team at Superior Health might reach out to you because we're kind of monitoring things behind the scenes. And if we see a big drop in your data and it's going way, way down, that typically means that we can tell that there's probably an error. It probably doesn't mean that you had way fewer people end up being up to date that 1 week. So if we ever do give you a call like that, know that it's likely we just want to make sure that your data, what CMS is seeing from NHSN, is accurate. And if it's not, we can work with you to kind of help repair it.
Yeah, that's a really good point, because we look at that data all the time and we can see the red flags. Doesn't mean they're wrong, but we see the red flags and we're on the phone saying, hey, does that look right to you? Is this correct or not? So thank you for bringing that up. We're watching you. We got your back.
Oh, Kim, you're on mute.
I am sorry again. I'm sorry again, everyone. I heard my dog barking, so I had to put myself on mute real quick. So where do you go to find your resources for NHSN? Not NHSN, by the way, but we have a slew of different resources here that you can go to. And of course, I did put in chat my email, Elena's email, and then we have a whole bunch of other quality improvement advisors that also work in NHSN to help you out. So if you have any further questions that need more explanation or to help you like with event level training or what have you, we can do an individual one-on-one with you. Other than that, how about some more questions? Does anybody else have anything they've been dying to answer? Or actually not answer, but to ask.
Get an answer.
Yes.
You can always feel free to unmute yourself or add things into the chat. We'll definitely address anything that comes in the chat, but we love to hear your voices and see your faces if you feel comfortable enough to unmute.
Well, I think I already got, I couldn't look, but I think I already got a couple of emails from the participants that have reached out for one-on-one assistance. So yes, thank you for reaching out, and we will be in touch.
Absolutely. I know that we have definitely some new names on this call today. So I know we got to answer quite a few questions already, like throughout the presentation. But if you came on specifically for this, please, please, please don't feel shy to ask any questions that we didn't cover today.
I don't have any questions. I'm just saying hi, and I appreciate Kim's help. I've worked with her for many years, and she called and helped me with some things. And so I just appreciate you guys.
Thank you. Kim is the best. I agree with, she is
She
great.
is. We were sad to lose her.
Oh, heck. Hi, Chrissy.
Hi, Kim.
It says you're Shannon, so it threw me off, but yeah.
Oh
We got
yeah.
a family reunion here. All right.
She sent me her link. Yeah, she sent me her link. I didn't realize it came up in her name.
Well, Chrissy, if you need any help with anything, just like anyone else, we'll do a little one-on-one, work you through anything. Do you use the event level forms?
I do not know. I use the other form, and then I just update it at the end and then count it. You know, our facility is very big, and for me to switch it all over would be a very tedious task that I don't have time for at this moment.
Absolutely. Like I said, the tricky part there was that they made it optional, and at that time it would have been the best time to switch over. And now, because those Excel forms wouldn't necessarily talk perfectly with NHSN, it wouldn't perfectly transfer all of the data you've been tracking probably in your own Excel over. So I totally agree with that. It makes it more complex for sure. So whatever works best for you, if that system is working really well with you, stick with it. If it's too much and you want to look at something else, that's where we can come in and kind of walk you through it.
It seems to work well. I seem to get through it pretty quickly.
Perfect.
So I just also wanted to add, I'm going off the NHSN topic, but we do have a lot of newer participants on this call today, and I really appreciate that. And I'm hoping that you'll come back for some more information. Just to give you a background, we have been conducting these calls with nursing home leadership for, my gosh, I think it's going on a year, if it isn't a little bit over a year now. And we've been doing this every week. And we have talked about everything under the sun. Of course, a lot of COVID, a lot of vaccination. We just talked about how to take a blood pressure the other day. We had a medical director come in and explain what her role is and what her role should be in a nursing home, for example. We just had a lot of things to talk about. And it's not just us that are doing the talking. What we like is that this is a time for you, the nursing home infection preventionists, the DONs, administrators, where we can talk with each other. You can share your experiences and maybe give each other some tips, maybe share a resource or two. We've had that happen before. And actually, even if you just need to vent a little, because we've had that happen too, because this is a safe place for you to do that. So again, we'll be putting out a new invite because like Elena said earlier, they're not going to be every week. Starting in January of 2023, we'll be doing them every other week. And actually, that even gives us more time to prepare, I guess you could say, more intense and meaningful presentations and ideas. That was a little bit of the reasoning behind going from week to every other week too. One of the big reasons. So, yeah. Does anybody else have any other questions?
I have something that goes along with what you just said, though, and I kind of want to ask everyone on the call this question. Would it be helpful to have a call similar to this more regularly, where you can come on and ask questions about NHSN? Obviously, there might not always be these big burning topics that we can present to you like we did today with some of these questions, but is that a need that you have? I mean, you can always reach out to our team and we can help you one-on-one, but sometimes you might forget our email address or whatever else. Is it helpful to have a call like this that's specific on NHSN? Or is this kind of helping you out enough? And now that you know that we can help you with this one-on-one, you're good.
While you're thinking, I was just going to say, while you're thinking about that, there's an evaluation that was dropped into the chat, or will be, I'm not sure at the moment. There is a spot on the evaluation for you to put in, what would you like to talk about? What have you just been struggling with? What do you need to hear or learn more about? If you want to put in a couple of suggestions in there, we'll definitely look into it and make that a possible future presentation.
And one other thing I will mention too is, even if we do have a specific topic on a call and it is not NHSN and you have an NHSN question, please feel free to ask them. Just because we have a specific topic doesn't mean that you can't ask questions that are not on that topic. So for instance, when we had that blood pressure presentation, if you had a question about reporting in NHSN, never hesitate to ask those questions during these calls. We provide you with a topic, but we really want these to be beneficial to all of you, where you could come on and ask any question that you might have that week or every other week, whatever frequency we're meeting. Mantha has a question in the chat. So how do you recommend tracking influenza for everyone for the one-time reporting we need to complete? Do you have recommendations on that, Kim?
Well, actually, I was wondering what all of you are doing for that. Yes, because I have heard people, different nursing homes that are literally just, I mean, they're using their own tracking system like they had made up for the COVID tracking system, their own spreadsheet. I did not hear if anyone is using the influenza tab. I don't know, tab's not the right word. That's in the long-term care module. So not the health safety personnel module. That's where you put your one report by May 15th. But in the other module where you report COVID, there is an influenza tab in there. Is anyone using that to keep track of their system? Or, yeah, what about your own electronic health record? I know, yeah, Point Click Care, I'm reading here, yes, has the system built right in there to keep track for, well, at least for the residents. I'm not sure about, I guess you could do staff. It depends if you have that module set up to track your personnel.
And Samantha mentions that. She says,
Yeah.
I can run a report on Point Click Care for residents and then keep a running tally for the season. Staff, we have so few. I have a sheet of paper with their names on them.
I guess I'm newer to the influenza reporting. And so I had previously had a way that I was tracking staff, so I just used that to come up with the numbers. My understanding is that we have to report the influenza rates monthly through May.
No, you do not have to report the influenza for healthcare personnel monthly. That is
Okay.
not a requirement. I mean, if you would like to, again, put that in NHSN, you have a tab for that, you can, but there's no requirement for it. You need to submit one report by May 15th under the healthcare safety personnel. Am I saying that right? It's me, my acronyms here. The HPS component. That's where you will submit the one report by May 15th. And again, I think, Chris, if you gave me your email here, we can talk about that. And I can give you more information on that also.
That sounds good. I mean, because I thought it was monthly, and so I've already submitted, but I'll just go back and edit that.
Yeah, well, so that's the
try to
problem.
wrap up flu shots like in December for staff. So it's like that'll be when my rate's the greatest. That's the number I want shared.
Yeah, that was a big, see, I think maybe some might be getting confused because when this quality measure came out, the instructions first indicated you had a option to be able to either report weekly or monthly or something of that nature, or to report at the end. That changed, and there's only one time to report, and it's in the HSP module. It will not count if you're doing that reporting in the long-term care facility long-term care module. It won't even count. So I'm hoping that everybody on this call isn't thinking that that's where, oh, I'm good, I reported there every month. I'm like, no, you have to, you might even have to actually enable that HSP component, enable it, and then be able to submit your data, because you might not even be using it yet.
And I think that is definitely something that when we get closer to May, when you'll be doing that, we could probably have a call specific to that, like this, a little bit closer to then, so you know exactly what to do.
Just looking in chat. Oh, just one time by March, I believe. And that was, we're still talking about influenza for staff, but it's May 15th, if that's what this question is about. Yeah.
Well, while others think about other questions you might have before we end, one other thing I want to plug, since plenty of you are new to this call and you might not be aware of this, it's kind of like it's almost like a social media, like sharing website type thing. It's free. It's called Superior Health Connect. It's a shared learning environment. Anyone that's part of Superior Health, which all of you likely are, if you've gotten our emails and things like that, you can come together, you can ask questions there. All of our team members are a part of that site. And if you ask a question there because you can't find one of our email addresses or whatever else, we can answer them there and then get connected with you on that. But definitely check out Superior Health Connect. It's another great place to find new resources from all of our team, not specific to COVID or nursing homes or NHSN. There's all sorts of different people that are involved in that Superior Health Connect. So if you're interested in that, definitely check that out. But any other questions about that, if you have any?
You know, for the influenza reporting, that's just for staff, correct? We don't have to report residents.
That is correct.
Okay.
Okay, well, again, thank you everyone for being here. Just a reminder, November 23rd, we have canceled that session due to the Thanksgiving holiday, but we will be back here on November 30th. And I am pretty darn sure we're going to be talking a bit about visitation. And I think it comes at a timely, because it's pretty timely, because all of you are already going to have to be gone through Thanksgiving holiday with everybody coming in your building, right? So we're going to kind of talk about that. How did that go? Of course, we'll give you some resources and we'll talk a little bit education first, but then, yeah, how did it go? Lessons learned? Any good tricks that you all learned from your first, well, it isn't your first holiday since COVID, but definitely things are changing again because everything is getting a little more lax in the community, but maybe not so much in the nursing home. So maybe we can have discussion on that. And then Christmas will be coming around the corner and we could implement our new findings for the Christmas holiday in your home. So we hope to see you then. And with that, everybody, I really enjoyed our discussion today and everybody's help. Appreciate it. And we will be in touch with those that have reached out to us. And I hope to see you all in a couple of weeks. Take care.
Have a
Bye-bye.
happy Thanksgiving.